interest of time, we will move on to the next talk by Dr. Meher on monofocal plus IOLs. Dr. Indrajit is here.
Good evening, everyone. Most of the slides that I have are already been covered by Dr. Mahipal Sachdev sir, so this will be a repetition. So no financial interest, sir.
So will you just take questions?
As you wish. Yeah. So, yeah. Since the world's population is increasing and the demand for IOLs is naturally rising, more and more patients expect that they'll be free from glasses, and number of premium IOLs are now in the market. It's really an incredible time to be in the cataract refractive space. Previously in the past, patient had no possibility of spectacle independence, but now patient has many opportunities. So how is intermediate vision important in our daily lives? There are increasing number of people who are working on laptops, tablets, phones, playing video games, watching TVs, reading subtitles. All these are where intermediate vision is useful for us. And the global average screen time is 6 hours and 58 minutes per day, which is mind-boggling. The younger generation, that is from 97 to 2010, they spend an average 9 hours per day on their screens. The millennials, that is born in 81 to 96, they spend around 3.7 hours a day on smartphones. And the previous generation, the baby boomers, they are almost 73% of them are active internet users. So necessity is the mother of invention. The industry has found a place for them to innovate, and then came the monofocal plus IOLs. The most commonly available monofocal plus IOLs in the market are now enhans by J&J, Ray1 EME by Rayner, and Envista. There are some more even confusing terminology. EDOF lenses, extended depth of focus. We have the Alcon Vivity, and previously we had Technis Symphony, and we even have it now. This slide I've just added this afternoon. I've seen when I'm roaming in the trade area. This is a strange IOL. I'm yet to use it, but they say that this is also a presbyopia correcting IOL, where it has to be implanted horizontally, and just like a progressive spectacle, it has distance, intermediate and near zones. It has to be seen how this performs. So a lot of interesting IOLs have come into the market. So what is monofocal plus IOL? It should provide a distance vision comparable to that of a monofocal IOL, and should provide some good intermediate visual acuity, that is at around 66 centimeters from the eye. Previously, the spherical aberration occurs when all the incoming light rays end up focusing at different points, but IOL based on spherical aberration can offer some depth of focus, but it can affect resolution and clarity, making it hard to obtain sharp images. Aspheric IOLs are therefore designed to provide sharp distance vision, but patients will require glasses for intermediate vision. And the zonal design in the bifocal and multifocal and trifocal IOLs can, though they provide good intermediate, near and distance vision, they have a larger halo pattern compared to standard monofocal IOLs, and low M2F ratio compared to monofocals. There came enhanced IOL, where there are no rings, no zones, no sphericity. It is based on a continuous higher order aspheric surface. There is a local increase in curvature in the center. This difference is so small that it does not affect the shape of the eye. It looks almost similar to their monofocal Technis IOL. And also both these lenses have same thickness in the center, which provides a good intermediate range. Like Dr. Mahipal has said, even this is Vivinex by Hoya. Vivinex Impress by Hoya is based on the same platform, and we even have Swiss Phobe by Apasami, which is of the same technology. And this is a study published in journal where they have compared enhan's monofocal IOL with enhan's IOL with their Technis monofocal IOL, where they have found that it really provided good intermediate vision. And also they have compared, this is another study where they have compared enhan's IOL with monofocal, similar monofocal IOL, where there is the higher order aberrations and halors were comparable to that of standard monofocal IOL. So intraocular lens designs are constantly evolving. It is important to assess not only the amount of vision provided, but the quality of vision is important. So we have to select our patients very carefully. Choosing the right patient for the right lens is important. Also, we have to explain that cataract surgery is done on two eyes and not just one, and we have to explain the patient that both eyes work together, and also that neuroadaptation is a part of this process, and sometimes it may take up to 6 months for the symptoms to settle down. And also, patients' expectations should be realistic. Patients need to know that there is no technology available to make them 20 years old again, but we have the technology that gives them a very high degree of freedom from glasses, and not necessarily zero, but low side effects. Thank you.
Nice talk. You've included most lenses, but there are a lot of EDOFs in the market. What is your percentage of use in your clinic? How many EDOFs, monofocals, trifocals do you use?
Actually, I have never used Technis Symphony, but VVT, I'm a VR surgeon. Okay. VVT I'm using for my patients who want the best IOL, but they have previously undergone a retinal surgery like macular hole or ERM, or some people who have had intermediate AMD or dry AMD. I'm preferring that because to standard trifocal IOLs.
So to the panel, I wanted to say there are so many confusing nomenclatures coming, advanced monofocals. I think the ANSI classification that is given, don't you think they all come under an EDOF category? I mean, an EDOF has so many different ways of working. There's a hybrid EDOF, there is a one which is working with the aberrations, there's a pinhole effect, and many such. So I think just the optic principle differs, but they are mainly giving you an intermediate vision where you can comfortably see for till an 8 and 9 and probably need a plus 1.5 for near. So even all these lenses that you mentioned may even come under the category of an EDOF.
If you have to classify by ANSI, you need to demonstrate at least 1.5 diopters. So things like IHands or Impress don't give 1.5 diopters. So you'll have to look at residual cylinder that nobody is talking about, the refractive status of the patient when they are measuring these things. You not measure the aberrations. If there is a small coma in that particular eye, he will not N8, he will be reading N6 also.
So we did a study recently with Clarion IOL, which is a monofocal lens, yes. And we found extremely surprising but great results for an intermediate vision. So which made us think, and now we have started that study to look at just monofocal IOLs with a monovision. Of course, we did that with a monovision. Yes. And I think every monofocal lens may give us that kind of an intermediate vision. Why will it change, sir? Why do you think it will change?
Age.
No, but the aspheric lenses, so I don't know about the others, but at least with Clarion, we found that it was kind of leaving behind some asphericity. So we saw, I mean, we do a lot of EDOF lenses. I think each in the brand, we've done autofocus also. Maybe.
See, you are talking about pseudo accommodation by the flexibility of the bag.
Fibrosis, capsular
but
fibrosis.
that is the cause of failure of crystalline, but that is not proven, or there is not so much of, the pseudophakic mobility has not been demonstrated to a great extent.
Actually, so what I'm trying to say is that I think the near ad is not just based on the lens, but like how he said, the other variables, the pupil size, the asphericity of the cornea. So an individual variability is also quite high.
Actually, Indian eyes, since we have brown pigmented iris, and if you look at older patients more than 70 years of age, the pupil size is hardly 2 millimeters, and that can add to a pinhole effect. That could be one reason where your monofocal or an eye hands might give you a better near vision than expected. Second is residual astigmatism. If you have a minor cylinder at 90 in few of your cases, you might notice that that really helps in enhancing the near vision. So there are a lot of factors that we need to consider when we are looking